what's next for CPOE? Obviously, on one side you have adoption, just getting people to use it.
Yes.
And then on the other side you have optimization. How do you improve CPOE and how folks are using it? Can you kind of speak to those?
Sure. I mean, that's a great question because we're seeing a lot of organizations, ourselves included, running into high adoption CPOE projects because of various deadlines that are out there and initiatives that are related to this. And as we look back, we see people sometimes unhappy with how the system works or how their content is organized. Our key in the first phase is getting physicians into the system, comfortable with the content, and generally standardizing evidence-based elements. The key to the optimization phase is comparing similar content and refining our content so that we only have one heart failure order set and not 4 heart failure order sets at 4 hospitals, so that it's easier to find what you need and that we can count on getting the right care to the right patient at the right time every time. We take every complaint as a request for improvement. So we take input from all the physicians. We set up email addresses, and we have frontline staff out in the hospitals soliciting feedback. We use our training sessions as feedback sessions, so we're not just telling you how it is today, it's how it has to be, but we want to know what you want to improve. And so we use training sessions to solicit feedback. We take that feedback to an integrated informatics IT change management meeting that happens once a week. That didn't exist last year, and now exists so that we can organize our changes, be aware of our changes, and rapidly improve our current system. It also helps us deploy innovations or new elements of the enterprise EMR that we want to use and not wait 2 or 3 months to do it. So we're doing 50, 60 changes a month now based on this process. And if you don't listen and move quickly after you go live on a project like CPOE, your physicians that you have engaged so heavily to get there can sometimes get off the bus. So we're trying to keep everybody on the bus.